Hey guys, sorry about that. We got cut off because we talked for too long. Sarah will jump back in and then we will continue. And I think it looks like I've been able to save it to IGTV, so that is awesome. It looks like we've managed to get through the technical glitches that we've seemed to have a couple of other times, so fingers crossed that it's all worked out. Oh. And yeah, make sure, let us know for our next chat, like anything that you'd be interested in talking about. And yeah, like pop us some suggestions. And as always, like just flick us a DM anytime because we're always keen to, talk about things that you're actually interested in. I think it's really important to cover those topics that are sort of specific. Yay, we're back.
Yeah, sorry, this is a long one, but
I think I
yeah,
saved it. It's uploading to IGTV now, so yay.
put it on YouTube as well.
Sweet.
Um, yeah, but that's right, it didn't really cut off anything that we were
I could see the timer counting down. I was like, oh God, we're about to get cut off.
Oh, good. Yeah, so I think it's worth talking about natural contractions versus induced contractions because they're not the same thing, and like saying that they are the same thing, that the cytosine just causes your uterus to contract the same as your normal hormones with it does is kind of unfair for women.
Yeah.
So with contractions that your body like causes by itself, they come in these sort of like kind of like waves, and they build up gradually over time. So that's why you have that kind of like early labor kind of thing, and your contractions might be like really, really manageable and far apart, and then they get longer and stronger and closer together as your labor sort of progresses. That allows your body time to build up its own natural endorphins, which are kind of like, the equivalent of morphine. It's your body's sort of
Natural
like
pain relief.
relief as well. So and the vast majority, of that early labor stage for most women is very manageable. Also, there's a lot of feedback that goes back and forth between your baby as well. He does have some kind of say over the contractions that are released, and then that therefore reduces like that your baby going into distress. Sometimes with women as well, which you don't really see this in hospitals because this is when women will be augmented, but out of hospital situations, women, like not uncommonly, will have a break in their labor, and it's usually between that sort of like, maybe after transition, or maybe even when they're fully dilated before they get that urge to push. And a lot of time I've give women some food and put them to bed. And I think it's a really important time because it's giving your body and your baby a rest before the pushing stage as well, which is kind of, it's obviously a lot harder work. It's different. And it's sort of like a bit more stress on your baby as well. So you both kind of like deserve this little break before you go through that as well.
So there's no reason when you get to 10 centimeters, it's like, okay, push, push, push. Like that's not
Yeah,
necessary.
not really. But with contractions that are caused by synthetic hormones, they are very, very sudden. So it's usually within 2 hours, women are experiencing really strong contractions, and the dose keeps getting put up and put up and put up until your contractions are for within a 10-minute period. So women really like the response we usually get is they feel like the contractions are on top of each other and they don't get a break in between. And women absolutely relish that break in between contractions. It gives you time to sort of catch your breath again. Some women even fall asleep in between their contractions when there's enough space in between. And there's no feedback between your body and your baby, so you're more likely your baby's more likely to go into distress as well.
Yeah. And that like that, as you said, that period between contractions is like where you get to like rest and be thankful and be like, okay, I'm not feeling anything now. Like you get that good break of like having no like sensation and no discomfort, no pain. Whereas like I've had women that I've worked with that say, like it feels like it's double peaking like the whole time.
And sometimes they get like on top of each other.
Yeah, because you're not really getting to get back into that, that dip of everything's good. And that slow, like gradual build with the peak, like it's sort of just like really hard and fast the whole time.
Yeah. And like I
And
feel
yeah,
like a midwife's point of view, it's hard to find that balance between like causing enough contractions that you're trying to aim for that 4 and 10, but then sending the baby into distress, or the woman into distress, so you want to cut it back, or every like now you've got like 6 contractions within 10 minutes, so you have to pull it back and then you have to build it back up again, and you're spending so much time with um
the machine, like fiddling with it.
yeah, not with the woman.
Yeah, and it seems like it's such a like a delicate balance to get that sweet spot of like, yep, woman's doing great, baby's great, we're getting those 4 in 10.
Yeah.
We're on it.
Yeah.
And like having a induction like with syntocin, like you're more likely to need to use like analgesia, which we talked about with our epidural talk, which is as you said on YouTube. And the biggest risk of to a baby during an induction is the syntocin. So towards the end, the baby needs to be prepared for birth with the strong contractions, pressure on the body, and the pressure on the body and in the birth canal can increase the baby going into distress. Because I guess the thing is that a lot of the time we don't really think when we're pregnant, we're in labor, like it's a massive ordeal. Like a baby's like they're getting like squeezed essentially with every surge that you're having. So when you're not getting a break, they're not getting a break, which is obviously like restricting like blood flow to the cord, through the placenta to the baby, which is obviously going to make them have like decelerations and not pick up as quickly. And that's why they do the constant fetal monitoring when you've had an induction, is that
and it's
because you're not getting that feedback.
So like babies are built to endure labor, and they're built to endure that squeeze release of the contractions. But when there's no time in between, they're not getting that blood flow of like oxygen rich blood back to them as well. They're not getting a break. So yeah, that's when they're more likely to become distressed.
Yeah, and I know I already sort of said this, but like when you're induced, like her contractions like come in waves much quicker and stronger in a much shorter period of time than what would happen if it was happening spontaneously. You don't get that opportunity to catch your breath and to have a bit of a rest. And then again, like this is where like that fear cycle starts. Like the fear, tension, pain cycle, which then contributes to the need for like interventions. And again, like pain relief, the natural methods that you may have had in your birth plan, you'll find they're not really like potentially hitting the spot, or you can really start to have like that downwards like mental spiral of I can't do this, I'm not getting a break. And then once you're in that mindset, it is so difficult to sort of pick yourself back out of it. And then obviously that's just adding to that cascade of intervention, isn't it? Babies then become distressed. Their heart rate drops due to the stronger contractions and the panic all round. And then it's like, let's get the baby out.
And
intervention.
Cascade of intervention.
Yeah, and like the thing is as well, like with having an induction, it's requiring, a constant like fetal tracking, like through a CTG. Vaginal examinations, it's every 4 hours. Is that the same with an induction? Is like the standard, like we'll just keep checking, or does it just vary? Like, what's your experience with that?
Actually ends up being like a lot more, because obviously, so really the induction process starts when you get a stretch and sweep, if that's what you've decided to do. So that's a vaginal exam. Sometimes you need multiple stretches and sweeps, so that's multiple vaginal exams. Then you need a vaginal exam to assess what the best method of induction is. Whether you can have your waters broken now, or whether you need the Prostin or Cervidil, or whether they can put a Foley's bulb in, or and then throughout that process as well, that 1 or 2 day process of the start of the induction, they're checking regularly as well. And then in the morning when they break your waters, and then they need to monitor that the syntocin is actually being effective from because
and then you've got the like possibility of having, if they can't get a good trace on baby's heart rate, with the fetal scalp electrode as well, which is again like another quite invasive thing to happen to the baby. And it's all of this like potential like bacteria getting introduced into your vagina, which like you don't want that at the best of times, let alone when you're in labor. And like all of these interventions are just severely interfering with your normal physiological response. and it inhibits the like natural labor hormones, which we've already gone over in our epidural talk and even today. And this is where like you can get that intense like dissatisfaction in your birth, and you can be like, my body failed, I had to be induced, I can't go into labor naturally. And that can have like a really like big effect on like not just the few weeks like in your fresh postpartum period, but like down the track with like subsequent pregnancies. And even, you know, when you're an older woman, like I was talking to a lady the other day who was telling me about her 3 births. She was in her 50s and she was still shattered by the fact that I never got to have a natural labor. I always had to be induced. My body just doesn't go into labor naturally. And that's something that she's been carrying for like 25 years.
Yeah.
And that's, you know, that's trauma. That's what we're passing to our babies and as well. And onto other people that we talk about birth with. Like this is like like an energy exchange that just keeps happening, and it's creating
Yeah.
that fear like within, you know, like the pregnant woman's subconscious. Like how many times when you're pregnant are you told like shitty birth stories or failed inductions, and then, you know, like you're taking all of that on and it's affecting that mindset, and then again like your hormones, and it just keeps rolling down from there.
Yeah, and like how does it affect your baby's hormone function when, you know, they're potentially having their own children and things like that as well.
Yes. Well, the trauma that a mother can affect, like can pass on to like her daughter when she's laboring. Like there's been
Oh yeah.
women that I've worked with that are like,
Yeah.
I didn't want my mum in the room because she was like, no, 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 like this is what happened to me. This is going to happen to you. It's genetic. Like you're going to have this happen, when it's like, as you said at the start, we don't really know fully on how those your genetics are working, because your mum was probably induced, and then
Yeah.
like even potentially her mum. So it's this real like cycle of like intervention and this cycle of trauma, and it's like we've got to stop it somewhere. Like what then? Where's
Yeah.
natural birth going to be? Like it's not going to be a thing anymore. No one's even going to know
Yeah.
what
I
it is or
almost
how to manage it.
natural birth is like it's
Mm,
at risk of being extinct. Like with a
mm,
birth without any intervention at all, a 100% physiological birth from the onset of labor to the birth of the placenta is minuscule. It's
yeah.
like 2% of women that actually have a physiological labor and birth of their placenta. That's how much we're interfering. Which I
And
think
that's
is,
insane. 2%. 2%.
yeah, we need to be like checking on that as well.
And I
Um,
think that also, Sarah, wraps back around to why a lot of doctors potentially recommend induction, because they're scared. Like they've got this fear that they're carrying because they don't see physiological birth. I mean, how many midwives don't even get to see physiological birth, like in its true essence, because it's just not
yeah,
happening?
it's really true, and like there is a lot of like a lot of student midwives coming at me and like I've never seen a truly physiological birth, and if we're not even seeing that during our training, how can we facilitate that? That's why,
Yeah.
yeah, you don't feel comfortable if you haven't experienced something. Of course, you don't feel comfortable facilitating it as well. I think that's especially in regards to like a physiological birth of the placenta. Like it's if a midwife or, you know, a care provider has never seen that before, they don't know how to support that to happen, and then
Yeah.
that therefore makes it a more dangerous situation when you've got fear and distrust coming from your care provider as well. Yeah, one of the studies that I was reading through was actually saying that they thought that the increased cesarean rate at 41 weeks wasn't due to anything physiological, it was due to care provider discomfort. So
Mm.
care providers were so uncomfortable with the fact that women were over 41 weeks that they were like, and because they don't see it, they were like, no, wait, cesarean, because, you know, how is this going to happen?
Mm. It's just like, it's such a tricky sort of thing to unpack, I feel, because there's so many like elements that are like creating this issue. Like it's not just like one thing, like, yeah, we just fix this and then everything's fine. Like there's so many sort of like different intertwining factors for
Yeah.
why, like, it's like, what's wrong with our body? Like, what is wrong with our bodies that stops us from going into labor? Nothing. Fear. Like that is
Yeah.
the thing that inhibits labor.
Our society's view of birth and the stress that we have in our lives and the stress that we
Mm.
have around birth, and I think over medicalized births have like I'm way more scared of that than birth itself.
Yeah.
Like as a pregnant woman, I would be much more afraid of the interventions that happen in or that can happen during your labor and birth than I am of birth itself.
Yeah, definitely. Um, It is, yeah, it's just such like a complex issue.
Mm. Yeah, just one important factor that we forgot to mention as well. It's like when like during the induction process, because you have to be monitored so closely and you've got so many sort of like drips and things hanging off you, it kind of does limit your access to your non-pharmacological pain relief options as well. Like I see that like in the UK, like women are able to get in the bath when they're being induced because they have
Mm.
monitors, like monitor them in the water. Australia do too. We just like to say that they don't work in the bath. So I think maybe some Australian hospitals are starting to do it, but it's definitely not something that I hear very much about. And even just like your freedom of movement, like you feel like a patient then, right? If you have all
Yeah.
these things hanging off you, you can't freely move around in the ways that you need to, like during labor and birth. And then
And
I
then it
guess
sort of
that
starts you having to ask permission, like, oh, can I move this? Can
yeah,
I, oh, can you help me with this? Rather than you like being like an autonomous woman and being able to be like, I feel like squatting or I feel like getting in the shower. Like you're having to
or
actually ask for
toilet.
assistance. Yeah,
You
or
can
go to the
please
toilet.
so I can go to the bathroom.
Yeah.
Yeah, it's really changes the dynamics then, doesn't it? And
Yeah.
not putting you in the dynamic that you should be in when you're about to give birth.
Well, you're no longer in the driver's seat, really, are you? Like you're not the one that's, like steering the ship. You've sort of had to hand that over.
Yeah, but I also want to add that actually, if just because you are being induced, there is even more need to have a birth plan then. It's like, okay, well, I'm being induced, or even if I'm, booked in for a cesarean, then therefore I have no options and I give away all my power. It's absolutely not the case at all.
Yeah.
Yeah, more important to sort of like check in with, you know, building a birth plan, and especially like Larni and myself offer services that can like it's not just like your birth plan is not just one thing, it's very very individualized and specialized, dependent on the woman as well, so we can sort of look at your individual circumstances and plan what things that you want as well, because doctors are a lot are like, oh no, you can't have a lotus birth, or you can't have delayed core clamping, or you can't have a physiological third stage if you're being induced, when that might not actually necessarily be the case. You still definitely have options. So, and even in
It's,
regards
yeah.
to sort of the induction process, it's, yeah, I'm happy to have like one-on-one consultations with people and talk about what the best options are for them based on their individual circumstances.
And as you said, I feel like it is definitely more important to have, like, if you know that you're having like a scheduled induction for like whatever reason, or a cesarean section, to know like what your options are and to have a plan in place. So people like, so your care provider and like your birthing partner knows like, okay, these are the things I want to try. Like, these are things that I really value as important to me. Or this is the type of induction I'm happy to try to start with. Like, like as you said, you don't have to just go straight for the Cinto.
Yeah. Yeah. Um, cool. Is there anything else?
I think it would be a really good spot to like finish with your analogy that you were saying today, because I freaking love
Yeah.
that, because it paints like such a perfect picture. Like it's really easy to visualize, and it's like an aha moment of like, yeah, you're so right.
Yeah, this is I'm definitely not claiming this because I read it years ago on the internet and I've just used it ever since, and I can't even remember where it came from. But it was pretty much an analogy about an apple. So an apple on a tree, if it's like green and not ready, like it's unripe, like how do you get that apple off? So you twist the apple, you twist it, you twist it, you twist it. If it's not coming off from you twisting it, what do? You need to cut the apple off the tree. But for like a big ripe apple, when it's ready, it will just fall off the tree. So I really think that paints a pretty stark picture about what induction of labor before your body's ready is like compared to you going into labor naturally yourself.
I love that. It's
Also,
like,
yeah, I just wanted to it's a powerful one.
yeah.
With like some resources. So on my website, which is the link is in my bio, I've got like a huge resource page. So the vast majority of what I'm going to read out is actually the links to those pages are on my page as well. But Rachel Reed is incredible. So she's a midwife. She's got a PhD. She's got a doctorate as well. She does the blog Midwife Thinking, and she has a lot of articles on like induction of labor for big babies and things like that. And she actually has a short ebook out, which is available on Amazon, and it's pretty cheap as well. It's like $10, and it is aimed at like birthing women. Is called Why Induction Matters. So it's not too complex to read. It's like a short, easy read. Evidence-based birth have lots of articles as well, and they have every single like natural induction method that you can think of as well, and they look at all the evidence for that as well. Sarah Wickham has heaps of blog posts on it as well. And the Queensland Health State Guidelines, if you Google Queensland Maternity and Neonatal Guidelines, the guidelines that care providers in Queensland should be abiding by are actually publicly available. So it is, worth accessing that as well. They're probably the most like digestible like kind of ones, but any podcasts that Rachel Reed has done, just like type in Rachel Reed to like the podcasts, like Apple podcast section or whatever, and listen to her interviews, because she's a lecturer as well at a university, so she knows all the current statistics, and yeah, she's
amazing.
She tells the truth.
Yeah.
Yeah, so definitely someone I'll recommend to look up.
Yeah, she's great. It's just, I feel like I had some other resource, but I didn't write it down. I'll have to do a post about it when it comes back.
But yeah, such a huge topic. Individualized. I feel like I just hear so many women being like, I had to be induced, or like, but I really, really encourage people to look information up themselves or ask opinions, alternatives, like really, really look into it, because induction of labor has just become the norm now, and we really, really need it not to be, because we don't know the long-term, like, there's so many negative long-term flow-on effects that we're not taking into account. I don't know, and I guess
it's hard to know what all of those are, because it's been like, I guess, like such a small blip in history so far. It's like we're not really going to see the outcomes from this for like, quite a few more years. And by that point, it's like, what is our induction rate going to be at by then, and how are we going to bring it back? Because it will like get to a point where people have forgotten like what natural birth is. And even I was reading something about breech birth specifically the other day, and there's so many obstetricians that don't know how to facilitate a breech birth, because it's just not really done anymore. And it's like, well, it used to happen. Like, obviously it had to happen at some stage. So yeah.
It's just about like, losing that exposure and losing that, familiarity and like comfort with a natural birth, because natural labor and births are totally different. They do not stick to a clock at all. I've looked after women for 3 days who are in relatively active labor that whole time, and they were fine, their baby was fine, they had great outcomes, and they were totally satisfied with their birth. That was the process that their body needed to go through, and I think with the right support, then there's nothing wrong with that. And I think from normalizing induction and how it is kind of like a quicker process. Usually with an induced labor, you will have a baby relatively quicker, but at what cost?
Yeah, at what cost?
Yeah,
definitely.
And so that's why people are uncomfortable with labor taking so long, because they don't see it in a hospital. That does not mean it's not normal.
And it's just important to note as well, like that it's not like a linear process. It's not, centimeter an hour or whatever to get to 10 centimeters. Like you can go from like 2 to 10 in like 15 minutes. Like it doesn't matter. And that is it blows my mind. It baffles me that is still a way of measuring progress of a labor, when it was introduced by a man and it was disproved.
It's been totally debunked as well, but we still use it. It's been proven that labor is not linear. That is not how labor works, yet we still use a partogram and go off this.
And it's like, again, with that too, like not every woman like needs to be 10 centimeters. Some go more, some go less, and that's okay. Like it's so individualized. Like everything about pregnancy and birth, like it's such a different thing per woman, and even per birth as well. Like even per baby, like I can attest to how different my 4 births have been. Like, and you know, one same person, same husband. You know what I mean? Like, and
Yeah.
that's just it's one person, let alone like the millions of women that are birthing.
Yeah.
Um, you can't find that. I mean, obviously, it's going to be like common threads, like woven in and out, but it's never going to be like a stencil, like a
Mm,
cookie cutter. It
yeah.
just can't.
Oh, I'll finish with a story actually of a birth that I've never forgotten. Of like this woman who had a hit, like I think it was baby number 5 or something, and she had had a history of like very very quick labors, and so this baby, she'd been in hospital overnight and she'd been like laboring but like hadn't had a baby, and they were questioning if something was wrong, and if they were like, okay, if she hasn't had a baby in a couple of hours, we're going to start put the syntocin on drip up even though she was already contracting. And yeah, so, like I'd never met this woman before, but as soon as I walked in I was just like, something is, you know, not, like she just seemed like so in her head. And I kind of just went up to her and I was just like, you know, like what's in your mind right now? Like what's holding you back? What are you worried about? And she didn't like say anything back to me. She walked into the bathroom and she had a baby. Because as soon as she let that go, whatever she was like mentally holding on to, like that's why our trauma, our past traumas and our past experiences come into our birth process so much. Because like if you have so much to unpack before you have that baby, then your labor's going to be longer. I see it played out time and time and time again. It's kind of like crazy how obvious it is when you actually sort of like see a natural labor and see it unfold like that, and then
Yeah.
talk to that woman and be like, what's going through your head at certain stages in your labor? So that's why, yeah, the preparation prior to birth, fear releasing, getting rid of your like, you know, ancestral traumas and things like that is so essential. And like also work that both Larni and I do with women.
And I was about to say, like, that sort of leads like into like a little like hint of something really cool that we're working on.
Oh yes.
Yeah, we've got something in the next like couple of weeks that we'll be releasing, which is
Yeah.
all to do with like preparing like your mind, body, soul, spirit for your birthing experience. And like doing the work, even preconception is like
Yep.
really important. And like, you know, not to think as well, like, oh my God, I'm pregnant already. I should have already prepared. It's like, no, you've still got time. At any point in your pregnancy where you're like, I want to take control of this, I want to deal with this, like whether you're 6 weeks or 36 weeks, like it's all important. Like it's
Yeah.
all, yeah, like the foundations of your birthing experience. And I'm so excited for what we're
Yes,
doing.
I'm so excited for what we have coming up as well. Yeah, so next couple of weeks we'll be releasing little hints of what we're going to be offering you as well. And for who just commented as well, send either of us a DM and we will have a conversation with you.
Yes. And yeah,
Yeah.
let us know what to talk about next. We sort of left it a bit in between because we got a bit caught up with life. But let's get back on the weekly wagon of this because I always have so much fun.
Yeah, but we're just creating something so awesome that we've kind of been more excited by that. But yeah, if anybody has any suggestions for what they would like us to talk about, send us a message and we will, yeah, plan another one.
And this should
Hopefully,
be on
one
IG.
doesn't go so long next time.
We just have so much to say. But yeah, hopefully this will be the first half should already be uploaded to IGTV, but I'll check after this. And feel free to like share it around with like any pregnant mamas that you feel, or dads like who are formed, like yeah, to anyone who you think would really vibe with this and get a lot out of it. Because
Yeah, and I will upload